everyone for coming to our conference. And again, our President-elect will talk a little bit about emerging issues. But I do want to explain something because I think the members need to be aware of just a little transition that occurred this year. Because obviously, Michael Holler, our current President-elect, doesn't look like Kelly Holiday. Kelly was our previous President-elect and was also and is currently in a very busy postgraduate program for a PhD. Kelly is currently still a very active member of our conference committee. We want to thank her for all her work, hard work that she has done. But some of you are running around saying, where's Kelly? Kelly is a member. Kelly has done some wonderful work. Kelly will continue to do some wonderful work. But for those of you that are questioning, I just felt to let you know, Kelly, because of her doctoral obligations, had to kind of step down. Michael was kind enough to step in. That's the only reason, okay? And so if you do see Kelly, please give her a big, big hug, because I can't even imagine what it would be like to be in my doctoral program and try to be President-elect, and especially as hard-driven as I can sometimes be. She's fabulous. So with that, I want to thank you for attending another conference. We're going to have a fun time, and we're going to have some wonderful breakout sessions. I want to introduce your current President-elect and my sidekick, Michael Holler.
Short people got no. Oh no, it's taped. I've run into that many times. As she told you, my name is Michael Holler, and I'm the President-elect, and I thank you for your kind attention, and I see a lot of faces I saw last night. Before I introduce our speakers, I wanted to take a few minutes to talk about where we're going and what the vision is going to be, hopefully, at least what I would like for it to be. You know, some of you who know me know that I'm not very subtle, and I'm very direct and to the point and kind of pushy sometimes, so I'm going to be that. That's going to be our theme. We are at a transition point as a profession, as an organization. Right now, there are a lot of things going on, and I just did a webinar about 3 weeks ago, which we're going to be making available as soon as Aaron Norton and I can get it together, because it was a 3-hour presentation on emerging issues in the field. Not to tout my presentation so much, it was 3 hours long, although I didn't have any complaints, miracle of miracles. But there was so much going on that as I went through the data to try to get the presentation together, at first I was thinking, how am I going to stretch this out to 60 minutes? By the time I was done, it was more like, how am I going to cram this into 3 hours? We are in a transition as a profession in that we are trying to accomplish a bunch of things nationally and even internationally. One is we have to stop being a group of groups, because nobody takes us seriously because of that. We're getting left out of a lot of discussions. When committees at the legislative levels, both nationally and state, start talking, they talk about, well, we need to refer this to the social workers, to the psychologists, to the psychiatrists, and we're kind of an afterthought. Somebody steps up and says, hey, you didn't say licensed mental health counselors. Oh yeah, and them too. So do we want our license to be called, oh yeah, and them too? I don't think so. So if we don't band together, and if we don't create a sense of unity, we're going to be left in the dust. As of right now, of all of the mental health professions, we are the fastest growing. We have improved the quality of our educational standards. We have improved and are continuing to improve the quality of our internship standards. But in different states, we are called different things. Here we're called licensed mental health counselors. In some states we're called licensed professional counselors. In some states we're called professional counselors. In some states we're called mental health counselors. In some states we're just called counselors. And there are a couple of other terms I can't even remember because they don't make any sense. And in some states the internship is 1,500 hours, and in some states it's 4,500 hours. So what we've been told is they look at us and say, well, we don't know exactly who you are and what you are. That's changing. But it's changing moving forward. So we have a couple of tasks. One is to make sure that that quality is adhered to and continually improved as much as we possibly can. The other is to try to speak to people who have come in before. For example, when I went to school, CACREP, which is now the new standard for certification in schools, accreditation is the word I'm looking for, what didn't exist, or well, it existed in about 5 schools. Mine was not one of them. When I applied for a national certified clinical mental health counselor certification through the National Board of Certified Counselors, I was told, oh, we don't think you'd like being a counselor. Isn't that where I am? I mean, come on. Okay, so, but that's what's happening to us as a group. So we've got to stop it. No one is going to do it for us. How are we going to do that? We have to band together. I am charging all of you, each of you, to go home and get other people to join. I hate to preach money, but look at what's going on. Money is buying votes. Votes are power. If we don't get together, we're not going to build enough membership, enough voting voices, enough calls to our legislators, enough money to pay for the lobbying and the political action committees. If we do not do that, we will be left behind. As you will hear the Mixons, our lobbyists, talk about, their favorite slogan is, we'll either be at the table or we'll be on the table. So we must act or be acted upon. My goal is to increase our membership, to improve the quality of our organization. We're expanding, we're going to grow. But right now we have over 6,000, my last information that I was provided, we have over 6,000 licensed mental health counselors in this state. We have about 600 members. What's wrong with this picture? It's up to us, folks. And what I've done in the 5 or so years I've been around here, I came to a FMHCA conference and was blown away with the quality of it. I just spoke to a past president about that. And I went out and I told other people about it, and I got people to join. Nobody told me to do that, like I'm telling you, but I did it because it made sense. It took care of me. It takes care of us. I'm asking you to do that. Don't just sit there. You must be proactive. Help us. Help us help you. So I'm being in your face and blunt, as I always am, and I'll say I'm sorry for it, but I'm not, because I'm advocating for you, to you. You must help yourself do that. We are going to be left out of Medicare if we're not careful. Right now, we have a very active legislative committee, thanks to Lori McCann. Stand up, Lori. This lady is our pitch hitter. She is our slugger. She's the one we put in for the home runs, and she has been actively campaigning to get us into Medicare as much as she can. And that continues. Please register at her table. They're giving away a free Kindle. We can speak to our legislators right there on the computer. Please do so. It only takes a few minutes, and the more voices we have, the more they take us seriously. They called us a group of groups and said at the legislative level that they don't take that seriously, and we've got to become a group.